Alright, this is part 3 update on my cancer journey. We're going to go back into history a little bit. This all started on July 31st, 2024. I'm doing an office visit with Murphy Townsend, my urologist. I had been urinating blood. I thought I'd been passing kidney stones, so I started straining my urine, only to discover it was a soft, rubbery material, like Roman noodles. Some of the chunks were so large I had to pull them out of the end of my penis. I knew then I was in big trouble. So after I consulted with the doctor and they ran some tests, he scheduled me for an ultrasound on September the 3rd. September the 3rd, I had the ultrasound, and it was ugly. So there was a mass in my bladder. The doctor originally thought it was my kidneys, but turns out my kidneys were fine, and it was in my bladder. And at this point in time, on September the 3rd, 2024, Dr. Townsend told me it was going to be a very long journey ahead of me. So we go from August the 3rd to September 16th. This was on a Monday. This is where they ran the video camera up inside my bladder and found the tumor. On September 18th, I went in and had a procedure to make sure my heart was good enough to be sedated. So on September the 20th, I had my first surgery, my first TURBT. I want to show you a real video of a TURBT. First, I want to show you a resectoscope. This is a resectoscope. This is what they put through your penis. And this is why it hurts so bad. And at the end of the resectoscope, there's a loop of wire that heats up and it burns the tumor. Here's a better view of the wire on the end. And here it is in action. You can actually see the loop of wire. If you watch it, you'll see it glow orange occasionally when they apply electrical current to it. This is the actual scraping process of a tumor inside a bladder. Doctors actually refer to this as scraping. So, I had my first scraping on September the 20th here. Surgery with Murphy Townsend. All right. Then 3 days later, he calls me on the phone and tells me, in his opinion, I should have the radical cystectomy and have the bladder removed, prostate removed, along with the seminal vessels and my lymph nodes. I know it was horrifying. It was just horrifying. And I talked to him again on September the 26th on the phone. Let's see, I had an office visit with my PCP on 29th to get some blood pressure medicine changed. August the 1st, I met with a doctor by the name of William Forehand. He is the chemo doctor. This was a consultation. October 2nd, I talked with Murphy Townsend again on the phone. As he said, it was going to be a long journey. October the 7th, I talked with David Carpenter. He is the radiation doctor. I met with him in his office. October 9th, I met with Benjamin Harper. He was the urology robotic surgeon that does all the body parts removal. October the 12th, I went and did a outpatient visit to the Imaging Center. This is where they put me in the machine and scan my whole body to see if the cancer is spread. This is where you go through something called scanxiety. They scan you and then it's 4 or 5 days before you get the results. And it came back negative. October 14th, I got a refill. October 17th, I met with Dr. Forehand, the chemo doctor, a second time in his office. Consultation. And I talked with Dr. Harper on the phone, the robotic surgeon, on October the 30th. November the 1st, I talked with Dr. Kameth. And then, let's see, November the 5th, I had the second scraping. So you have to have 2 scrapings, because at this point I had decided I was going to go the chemo radiation route. So you have to have 2 scrapings, because it's like cutting down a tree. They, chop up the tree, cleaning up the mess, blow the driveway, then somebody else comes back a few days later and grinds up the stump. So on November the 5th, I had the second scraping with Dr. Harper, the robotic surgeon. He did the second scraping for me because Dr. Townsend had retired. And then on November the 6th, I talked to the nurse. Let's see, I don't even know what I did on November 7th or 12th. And let's see, November 24th. Okay, so I had the second scraping on November the 5th, which was Election Day. You got to wait 4 weeks after that before you could start treatments. But you can start other things. So on November 24th, I went in to the radiation doctor, and I did what they call radiation simulation, where they put you in the machine, locate your bladder, your tumor. They put 3 tattoos on your body. They're like little small black freckles, so that when you go in for treatments, the machine can automatically align to the right spot using those dots and laser beams. On December the 2nd, this was interesting. I went in and had my Chemo Port installed. I didn't even know what a Chemo Port was. A Chemo Port is a hard plastic membrane that's implanted in your chest. Let's see if I can pull up a picture of a Chemo Port. Yeah, that would be interesting. Chemo Port. Let's see, let's find one. Somebody's got one. This is it right here. So the Chemo Port was put in your chest. It's a hard plastic membrane, and it goes into the jugular vein directly into the heart. This is so they can draw blood and infuse chemo without having to stick you with a needle. You'll see an actual video of my Chemo Port later. So they don't have to keep constantly sticking you in the veins. Well, that was my understanding, but actually it turned out there's another reason I got a Chemo Port. So I got my Chemo Port installed on December the 2nd. December the 4th, I had a nurse visit. This was chemo class. This is where I discovered the real reason for the Chemo Port. I was going to be put on a chemo pump that I would be taken home for 5 days, and they can't let you just roll around in your bed at home with a needle in your arm. They got to have that port so that the hose can connect to it. It's kind of like a quick disconnect. So I was set to start treatments on December the 9th, and that's when things kind of went off the rails. On December the 5th, I went and had my head shaved, and that was, I believe, on a Thursday. And Thursday afternoon, my insurance company, Aetna, called and said, sorry, we're not going to pay for your treatments. They actually called me up with a robot, of all things. After they verified my date of birth, the robot goes, we are sorry, we are declining your coverage for radiation therapy. You have been declined. You will receive a letter in the mail. Thank you. Bye. Click. They called me with a robot. It says, radiation therapy for bladder cancer. Why did we deny your request? You have cancer. It has not been shown that your cancer type has responded well to the requested type of treatment. So my doctor calls me about 30 minutes later and said, this is normal. They deny everything. He says he'll file an appeal. The next day, on Friday, Aetna calls, a live lady calls me. And she says she received their appeal and that we would have the answer in 3 days. And I asked her about the robot. Oh, we don't use robots. No, we'd never do that. And of course, this is the same time that United Healthcare CEO had been murdered and they were still looking for the suspect. The irony of it all, right? So on Saturday, Aetna calls now saying they are going to cover. So everything got rescheduled for December the 16th. So on December the 16th, I went in for my first infusion, and I'm going to show you some videos of this. And on December the 22nd, I got my chemo pump disconnected. So that's it for the moment. And I have my next chemo appointment with my next doctor on December the 30th. Yep, it's been a long journey. Let's see here. What did I want to show you? I want to show you some videos. The first video I'm going to show you I'm in the infusion center. I'm at the nurse's station. I'm in the area where the overflow is. And I want to show you this. Move back up some here. I want you to see this older woman here. She's sitting across from me. She's 82 years old. She's dying of breast cancer. Her daughter's sitting there with her. And it took them 3 hours and 2 different nurses before they could finally find a vein to put in her needle in. She did not have a port. Oh, the ports are so nice. They're worth the extra trouble. Okay, so this lady sitting next to me was 35 years old, being treated for breast cancer. The reason I know their ages is because every time the doctor or nurse comes over and says something, they automatically ask your name and date of birth, so it's not hard to figure out people's ages. It doesn't look like a lot of people in there because we're at the nurse's station. But in the far back of the room, and here's me smiling about my situation. I can't believe this. So I get up and I walk to the back of the room to go to use the restroom, and there's probably 100 of those chairs, every one of them full of women being treated with breast cancer. I was the only man in the entire infusion center. So I then get my first round of chemotherapy. Alright, so here the nurse is pushing the chemo through this syringe into this port somewhere. You can see the port in my chest. Somewhere in here. My chemo port. There's a better view of it later. Alright. This blue drug, alright, so here is mitomycin C. They gave me 2 syringes of this on Monday the 16th of December. Mitomycin C. Then after that, they hooked the chemo pump up. Now, let me show you the chemo pump. This is after I got home. Alright, I just got home. Here's my chemotherapy pump. You can see it says 117 hours and 29 minutes. That's the time left. It started at 120 hours. There's a big tank of chemo on the bottom of this. 225 milliliters left to pump. So it comes out of this tube. And this tube comes under my shirt. And it comes up to this port on my chest. Now you can see the port. Where it plugs in. Yeah, that's where it plugs in. I will be wearing this until Saturday morning, at which point it will pump out all the fluid, and then I will go up to the hospital Saturday morning and get it removed. Okay, this is pumping a different kind of chemo. So the blue syringes was mitomycin C, and this chemo is fluorosil. It's called 5FU. Interesting name for it. And it's kind of pain in the butt to sleep with the pump. You can't shower with the pump. I left the pump sitting on the toilet lid and just did sit-down baths for 5 days. I left out the fact that on December the 5th, the day that Aetna called to deny the coverage, earlier that day I went in and had my head shaved. I didn't want to go through the deal of all my hair falling out and getting all over my pillow and my bathroom sink. So I tried to avoid that. Let's see, here we go to the radiation lobby. So here I am at Wellstar Radiation Oncology. This is the 16th of December after I got my mitomycin infusion and my pump, and I'm now heading down for my first radiation treatment. I am the only patient I ever see come in here wearing the chemo pump. Waiting for my 1:30 appointment is about 20 minutes after. All right, so here's what it looks like inside the radiation room.
How thick it is.
That's the nuclear accelerator. That's the table they put you on.
No, you don't want to be in it.
Yeah. Check out this door.
Look at how big it is.
Look how thick this door is.
Yeah, that's why they got this thing down here in the hole in the ground. Thank you. See you tomorrow.
All right, so they got this down in a hole in the ground. I think that's for prevention of X-rays escaping or terrorist attacks on a nuclear accelerator. So, what I want to talk about now is my journey. I typed up December 25th. You know, many weeks back in my cancer journey, I consulted with several different doctors. My urologist I have seen the past 20 years announced he was retiring October 31st, so he referred me to one of the younger colleagues, a robotic surgeon. This doctor told me there was only one effective treatment for bladder cancer in men, and that is what's known as a radical cystectomy. This is where they remove your cancerous bladder, the prostate, seminal vessels, and lymph nodes. Your urine then drains into a plastic bag mounted on the outside of your belly. And then you empty that as needed. The horror that cannot be described the first time it's explained to you, especially when you know you'll be impotent the rest of your life. And that's made worse when everything is currently working perfectly. Your penis then becomes a limp piece of useless flesh. You lose your dignity and everything that makes you a man. I had a dream I did that surgery and had the plastic bag. Then one day, 6 months later, I had blood in my stool, only to discover that I now had colon cancer and would need a second plastic bag. Surely there's not people like that. Yes, there are many people living with two plastic bags, one for urine, one for poop. I refused. I told this doctor I would rather die. And that's exactly how I feel, than to do that radical surgery. I then asked him what would happen if I did nothing at all and simply let nature take its course, and his answer was chilling. You will soon die a very painful death. I then consulted with a radiation oncologist and a chemotherapy doctor. They told me they could start me on a treatment plan of both radiation and chemo if I was unwilling to do the radical surgery. This sounded good. They even had me convinced the odds were 60 to 70% successful, showing me graphs on their computers. It made me wonder why more people didn't go this route. Well, I'm going to tell you, I found out why later. So after some additional consultations, research, and study, I decided to move forth with the radiation and chemo. Before doing this, I had to have a second TURBT surgery to ensure most of the tumor had been removed from the first TURB surgery. That didn't usually get it all in the first surgery, like cutting down a tree. Someone comes back later and grounds out the stump. This is normal. It's normal to have two TURBTs. The second surgery took place on November 5th. I had to wait 4 weeks after that before starting radio chemo. Then everything started to confuse. I went to radiation simulation testing on November 21st, had my chemo. Injection port surgery implanted on December 2nd, went to chemo class on December 4th, shaved my head on December 5th with the intent to start treatments on December the 9th. But on December 5th, about 1 hour after I had shaved my head, I got a phone call from Aetna Insurance. A robot informed me my radio chemo treatment coverage had been denied and that I would receive a letter in the mail with the explanation of the denial. Then click, the robot just hung up. My doctor called me about 1 hour later and told me the same and said that Aetna would only cover the radical surgery to gut me like a fish, but he would appeal. He appealed the same day, so everything was moved out 1 week. The next day, Friday, December the 6th, I got a phone call from a live Aetna agent just letting me know the appeal had been received and I would get an answer in 3 days. She denied that Aetna used robots to place phone calls for denials of coverage. That was not true. they do, and they did. This was also the same time frame in which the United Healthcare CEO had been murdered. The irony of it all. The next day, Saturday, December 7th, Aetna called again to inform me they would now cover the radio chemo treatment, so now everything was set to begin Monday, December 16th. On December 10th, I got the denial letter from Aetna that crossed paths in the mail. The reason for denial was that it has been shown that my type of cancer has not responded well to radiation therapy. Thus, they didn't cover it. So it kind of sounds like it doesn't work. Basically, according to Aetna, radio chemotherapy for bladder cancer is pretty much ineffective for whatever medical reasons. Thus, the reasons they don't normally cover it. I started radiation and chemo on Monday, December 16th. How sad it was inside the Infusion Center. The place jammed full of young, middle-aged, and very old women with breast cancer. My infusions of chemo drugs were different from what everyone else was getting. I got 2 huge infusions directly into my heart of what looks like purple caulking guns, then got placed on a 24/7 at-home chemo pump I wear for 7 days, constantly pumping chemo directly into my heart. That machine would pump once every 3 minutes. You could sit there in bed and hear it. I've had at this time of this writing 4 of the 35 prescribed radiation treatments. I have experienced, strangely enough, 0 side effects from any of this. But as it turns out, since this treatment is basically ineffective, I'm really not doing much more than nothing at all. It's like the 2 oncologists decided to do this radio chemo so they could say that at least they're doing something. That is what is happening. The end result is the same. I'm basically doing nothing at all. I'm eventually going to die that painful death that robotic surgeon warned me of. It's just a matter of time. This is why most everyone else goes the radical surgery route, but I could not. I previously had little interest in filling out an advance directive until all this came clear to me recently, so now I have. Upon my end of life, I want no pain medicine, no matter how bad it gets. Even if I lose my ability to speak and appear to mumble, asking for pain medicine, I want no pain medicine to be administered. Even if it appears I'm trying to put in writing asking for it, do not give me any pain medicine. If any of my family members try to get a court order to overturn my advance directive, I deny any judge any authority to do that. That's basically all I put in my advance directive, as that's all I care about. I have decided when the time comes I want to die with all my pain. I want to feel all my pain the surgeon described I would experience. I will not tap out. I will finish having the multiple rounds of chemo and my 35 radiation treatments, which conclude on February 5th, 2025. Then that's when we get to the point where the doctors will always say the same thing. We're very sorry. We have done all that we can do. Then I will go home and I will die this painful death. I am not afraid. I want to make it this point. I am not afraid. I am only disappointed. And disappointment can be tough to deal with as well. Jesus didn't tap, and neither will I. So that's where I'm at. I've actually completed 7 of the radiation treatments, 1 round of chemo, and to be honest, I feel really good. I'm ready to start running again. But all hope is not lost. I still have one last winning card to play. And that will be part 4.